It's Russ Curtis. Thanks for joining me today. I really wanted to highlight something new that I think is helping fine-tune assessing and hopefully preventing suicides, particularly related to intention. Let me go right into this. When we're assessing for the risk of suicide, you probably have heard the acronym PIMP, Plan, Intention, Means, and Prior Attempt, as main factors that we want to assess to determine the lethality, the risk of somebody committing suicide. Clearly a plan, a detailed plan that somebody has, that would indicate somebody more at risk than a vague plan. The intention has sometimes been more difficult to assess, like how likely, that's what we mean by intention, how likely are they to carry through the plan? And with the Thomas Joiner's model, he introduced how fearlessness is a big factor in completed suicides. And so, and a couple of the other factors in his model are, does the person feel like they belong, and do they feel like they are a burden? So these are other indicators to assess. Belongingness, I always think about purpose, pets, or people. Okay, do people feel that they no longer have purpose? Do they don't feel like they need to or are helpful for their pets or other people anymore? And do they feel like they're just a burden to anybody around them? So these are all important, but the fearlessness is that actually to commit suicide does require fearlessness, and we can assess for that by asking about a history of risk-taking. Thrill-seeking behavior can be one way to try to assess for that. I think it's also helpful to ask about family history. There is some correlation between family history of suicide and the client's intention for suicide. Also, this is from Thomas Joiner talking about blinking rates, that if you're actually in an interview with a person and assessing that people that are very intently staring and not blinking as frequently as normal, so it's nice to have a baseline, that this can be an indication of somebody who's already very at risk, who's kind of made up their mind. Okay, so be sure to look for his YouTube video because it's really good and talks about his model and so forth. But just assessing intention has always seemed a little vague, and so I would definitely assess for fearlessness. A couple things to think about that are history of risk-taking and thrill-seeking behavior. With means, gun, very lethal means. Pills can be, of course, they all can be, but we just want to assess and find out the severity. If there's guns in the house, it's nice if we're working with somebody that doesn't need to be committed to ask if they can put a barrier between them and the guns, put them up in the attic, make sure that they're locked and somebody else has the key, or that the ammunition has been taken out. So at least there's some time for this person to give this more thought as to why they should live or want to live. And then prior attempts. Okay, so there is that correlation with folks that have had a prior attempt with actually completed suicides. But again, just wanted to focus on the intention. All right, thanks for all the good work you do. Hope this was helpful, and we'll talk to you in the next video. Take care.